Hello, everyone, and welcome to our National Primary Care Week webinar today. My name is Jenna Fox, and I'm the Primary Care Coordinator for the American Medical Student Association. We have a great talk for you here today with Dr. Adrian Billings, who's a full-spectrum family physician who holds a PhD in experimental pathology and is a former National Health Service Corps scholar from Alpine, Texas. He serves as Associate Professor in the Department of Family and Community Medicine at Texas Tech University School of Medicine and is a staff physician at Big Bend Regional Medical Center in Alpine, Texas. Dr. Billings currently serves as the National Health Service Corps National Advisory Council and most recently represented the NHSC as one of only 3 private sector advisors selected as a U.S. delegate to the World Health Organization's 67th World Health Assembly in Geneva, Switzerland. Drawing upon his experience working on the rural frontier, he spoke in support of a proposed WHO resolution that rural family physicians worldwide should receive training in 11 different life-saving surgeries. Dr. Billings is also the medical director for student health services at Sul Ross State University. So it should be a great webinar, and thank you so much for joining us, Dr. Billings.
Yeah, thank you so much. I'm going to try and start this with a little living it up. All right. Well, I'm really humbled and honored to be here today, and I want to thank Diane and Jenna for all the legwork that they've done to make this possible. We're literally coming to you today from the end of the power lines down in Presidio, Texas, down on the Texas-Mexico border. So I'm really impressed that we're able to connect with you from such an isolated area in Texas to you. So I hope that everything goes well and we can do this. But I've called this Southwestern Exposure. Many of y'all may be too young to remember a sitcom called Northern Exposure that I remember from my childhood, which was a very popular sitcom at the time in the 80s about a National Health Service Corps doctor that went to Alaska, and it wasn't really where he wanted to go, but the story of the sitcom is that he falls in love with this rural, isolated Alaskan community and really becomes part of the community. So you'll see here, I'm kind of a prisoner of the highway. I practice in Alpine, which is where our hospital is, in Marfa, which is where one of our clinics is, and then today I'm coming to you from Presidio down here on the Texas-Mexico border. So I spend every day commuting a little bit, but it's really to access the patients. It's just what we have to do out here. So who am I and why am I coming to you? Well, I'm very proud to be a former National Health Service Corps scholar. And that means that when I matriculated into medical school, I knew I wanted to go into primary care, and I accepted a scholarship from the federal government called the National Health Service Corps. And then my repayment was I graduated with no loans. I just owed 4 years of commitment because my contract was a 4-year commitment, and so I repaid that by practicing exactly where I wanted to, very close to my hometown in Alpine, Texas, and I'm still out here practicing, and I completed my obligation in 2011. As Jenna said, I'm a family medicine and obstetrics physician. I still deliver babies. I still do C-sections. Our hospital is a critical access hospital in Alpine, which is where I live, and it's called Big Bend Regional Medical Center. And I am the Chief Medical Officer for Presidio County Health Services. Presidio County Health Services is a federally qualified health center, and this may be a new term to y'all, but it's one of the community health centers that is very common in the United States, and we are essentially a safety net clinic for patients that don't have health insurance. We have a sliding fee scale for patients that are a certain percentage below the poverty level, and we see everybody. We can see patients with insurance, and the nice thing about federally qualified health centers is that we can provide a sliding fee scale to patients that don't have the ability to pay for our services. A new thing for me over the past couple of years is that I'm also an associate professor with the Department of Family and Community Medicine at Texas Tech University Health Sciences Center. And in this capacity, I host medical students and residents about 75% of my time. And it's probably the most fun part of my job is getting to expose new medical students and residents they're probably most of the time their first time ever doing border health and even doing rural medicine. And in that regard, we're actually developing a rural family medicine program out here on the border, and we'll have our first resident starting in July of 2015. So where is the Big Bend region of Texas? Well, if you're looking at the screen, it's the far left side of the screen where the Big Bend, which refers to the Big Bend in the Rio Grande River, occurs. And this is the most isolated and rural part of all of Texas. Alpine, which is where I live, which is where the hospital is a town of 5,725. Marfa, which is where I practice 4 days out of the week, is 23 miles to the west of Alpine, and it's a small town of 1,819. And where I'm coming to you today from is 60 miles south of Marfa, or 90 miles southwest of Alpine, and it's a town of 4,079 right on the Texas-Mexico border. And I think that I live in the most beautiful part of Texas, and it's a part of Texas that a lot of people don't realize there are actually mountains in Texas, and this shows you the elevation change that occurs between Presidio and Marfa, anywhere from 2,582 feet to 4,685 feet. It's a very diverse population out here. The majority of the population is Hispanic. Down here in Presidio, the predominant language is Spanish. There's an artist population that lives out in Marfa and Alpine as well, and that adds to the diversity. And of course, because we're close to the Mexican border, we have a large law enforcement community. There's also thankfully, there's a four-year college out here called Sul Ross State University, and that's located in Alpine. And its history is it's a primarily Mexican-American university, just as you may have heard of primarily African-American universities. Sul Ross is predominantly a Mexican-American university, and its mission is to train first-generation college students, that is, college students whose parents never were able to go to college. Its real mission is to educate the people of West Texas, and primarily in the areas of education to educate teachers to populate the rural schools out here, as well as law enforcement and agriculture. There's a wonderful culture out here. I want you to know that rural areas do have their own culture, and we, because of our diversity out here, we have an amazing culture out here. The hospital that serves this 12,000 square mile area is in Alpine, as I said, and it's called Big Bend Regional Medical Center. And it serves a total population in this 12,000 square mile area of about 25,000 patients. So here's a little schematic showing you where Alpine, Marfa, and Presidio are, again, out in the far western part of Texas. And this shows you a little bit of the rolling mountains. This is actually a view from Alpine looking down Sul Ross Mountain at Sul Ross State University in Alpine. And again, this is where I live, actually about a mile from where this picture was taken. This is looking at Mexico from Presidio. This is just outside of Presidio, and this is the Rio Grande. And it doesn't look real grande right here because we've been in the middle of a drought. And this is looking at some Mexican cows. Agriculture is very popular out here. And then this is the town of Marfa, which is where one of our clinics is and where I'm at 4 days out of the week. And you can also see the mountains here. The climate out here is just wonderful. In Marfa, we're oftentimes the most cool part of the state, and in Presidio, we're oftentimes the most hot part of the state. This shows a schematic of that 12,000 square mile area that our hospital in Alpine captures. And what you see here is some roads that are in green and then one on the far right that is in red. There's some unique challenges in addition to the geography of the out here where towns are a wide, long commuting distance. There's also some interesting challenges down on the Texas-Mexico border and excuse me, the U.S.-Mexico border. On all the highways on the northbound side, there are United States Immigration and Customs inspection points only on the northbound side of those highways. And what those do is that they are making sure that only United States citizens or those who have legal entry into the United States can pass and go northbound. What this does is this unfortunately creates a barrier to health care for any immigrants that are not here legally that live south of those checkpoints. They can then not come up north of there to access health care. up until about 2 years ago when I started coming down to Presidio on the Mexican border, about 25% of our deliveries in Alpine were these unassigned patients that were not able to access health care because of the checkpoints. And we have, by coming down here to Presidio now that we started about 2 years ago and seeing prenatal patients, we've greatly and significantly reduced the number of unassigned deliveries in Alpine because we're now able to give them prenatal care south of those immigration checkpoints. So what do I do as a rural family physician on the Texas-Mexico border? Well, really I do everything, whether I want to or not, and I like that. That's why I became a family physician. I enjoy that challenge, and I've always wanted to be somebody who knows a little bit about a lot and not a whole lot about one narrow subject or one specialty in medicine. I do family medicine. I moonlight at times in the emergency room. As I told you, I still deliver babies. I take care of our hospital patients in the hospital. Up until about 2 years ago, we had a nursing home in Alpine, and so I was doing nursing home rounds as well. But unfortunately, our nursing home closed in Alpine and for financial reasons. I also used to do the Sol Ross Student Health. I used to be the medical director for when I practiced in Alpine at a clinic location there for Sol Ross, and that was really great, reaching a lot of first-generation college students, many of them who were still on Medicaid, or if they had aged out, they were used to be former Medicaid patients. And I do lots of procedures in the hospital and in the clinic as well. And one of the most surprising things when people that are outside of medicine, and even some that are in medicine, when they find out that I still do house calls, that's probably more surprising to them rather than the fact that I still deliver babies and whatnot, is the fact that I still do house calls. And I do enjoy that, and I would encourage you as a medical student to get out and try and do some house calls with some of your faculty, because it's just a great window into the social life of your patients, and you can really understand some of their social challenges. The procedures that I do surgical obstetrics. I did an obstetrical fellowship for 1 year after I finished my family medicine rotation residency, and so I do C-sections, I do tubals, dilatation and curettages, I do hysteroscopy, endoscopy, circumcisions, and colposcopy, and I like doing all of these things. And I don't necessarily do my job because it's easy or, you know, I really think that I'm serving a role out here in providing services that are really needed by the community. And I really like this quote up here, and I try and live by this, that, you know, I kind of think that my, and I'd hope that your duty is to be useful, not according to what we want to do or what's easy for us, but according to our powers. And so I think I've had some amazing mentors and people that have supported me and trained me through college, medical school, and residency, that I really feel that you know, I have a duty and obligation to serve and help the community, not on my own terms, but you know, whenever someone needs help, I hope that I'm able to be there for them. Our hospital, as I alluded to, is Big Bend Regional Medical Center in Alpine, a critical access hospital. It has only 25 beds. Most of the time, I trained in Fort Worth at John Peter Smith, a large urban county hospital, and each floor at least had 25 beds. So our whole hospital is smaller than just one ward or one floor of my training hospital. We have a labor and delivery unit that has 2 delivery rooms, and we do about 200 deliveries per year. We have a single medical surgical floor, an operating room with 2 operating room suites and a special procedure room. We have a radiology department that can offer CAT scans, plain films, and ultrasounds. We are not able to do any MRIs except with a truck that comes in once a week to do MRIs. We don't have any nuclear medicine capabilities, so we can't do any cardiac stress testing that requires nuclear medicine. And then we have a physical therapy department. And our medical staff, this has changed recently, and this is kind of exciting. When I first came to Alpine 7 years ago, this slide would have read 3 family physicians, 1 general surgeon, 1 radiologist, and then 1 certified registered nurse anesthetist. I have been really fortunate, and this has been another reason that I've hosted medical students and residents, is that when I first came out here for my first 6 years, I was solo practice on call 24/7. And I got pretty lonely. I missed having somebody around, so I reached out to Texas Tech and then my alma mater, the University of Texas Medical Branch, to start hosting medical students. and I've been in residence, and I've been really fortunate. I've been able to recruit back 3 former medical students and residents to come back and join us. And so I think that's been a great recruiting tool. In addition to me, it's definitely made me a better physician having medical students and residents around, because y'all are very intelligent. You ask really good questions, and I hope you know that the learning is a two-way process between you and the attending. It's not unidirectional with just the attending teaching you. You're also teaching the attendings. So we now have 6 family physicians out in this area, 1 pediatrician, 1 obstetrician gynecologist, a single general surgeon, a radiologist, and we have an emergency medicine physician staffing group of emergency room physicians that staff our emergency room. Prior to this, the community doctors were staffing the emergency room, and this has greatly improved our quality of life, and that we're not tied down to the emergency room. And all of these physicians fly in or drive in from usually urban areas. And then we have 1 certified registered nurse anesthetist who provides all of our anesthesia. Typical day, again, this is why I like doing what I do. I don't have a typical day, and I like that. That keeps it exciting for me, and it keeps me learning, and it keeps me on my tips of my toes. Usually the days that I'm on call, which I now have a partner, so I'm on call one week at a time, and 1 week I'm just doing clinic. So I've got finally some protected family time. But on the weeks that I'm on call, I start out by rounding at the hospital. If I have any elective surgeries to do, such as repeat C-sections or tubules, I'll do them in the morning. Then I had to, over 4 days of the week, I'd drive 23 miles over to Marfa and do clinic. And then 1 day a week, on Thursdays, I drive 90 miles one way to get to our clinic in Presidio. And I have lunch with the staff. I really like that. That's kind of good time just to socialize with the staff. When I'm down here today, I'm actually going to try and go sit on the banks of the Rio Grande and have a picnic lunch. I have a Texas Tech medical student with me, Risa Welch, and I haven't taken her to the Rio Grande yet. So that's our plan today at lunchtime after we get done here. Come back and do clinic, and then I'll do check-in rounds to head to the hospital. If I have any new admits, I'll do their history and physicals and tuck them in for the night. And I'm also just trying to decrease any potential crises or telephone calls in the middle of the night that might wake me up. So I really do check-in rounds to try and get people tucked in for the night so that hopefully there's no problems. And then when I can, I sleep. I do enjoy sleeping. This is our bloodhound, Chula, and she was really good at the residency mantra. And if you haven't heard this yet, you soon will as you start residency. It's eat when you can, sit when you can, and sleep when you can. And this is something that I still live by. In this slide, it says why rural practice, but this might say why underserved practice as well. You're needed, and you're really needed desperately. These patients out here may not have a physician or a clinician if you don't decide to come out and practice in an underserved area. Because of this, you can really make a difference, and you can serve those who are in need and really, really appreciate what you do, because you're accepting the call to come and serve where many of your colleagues either don't have the skills and or don't have the desire to come and serve this population. Because of this, you can really affect public health one patient at a time if you're a physician out in a rural or an urban underserved area. And you're really in a rural area anyways, you're really a big fish in a small pond. You kind of get to feel like a little local celebrity. And this can be good in the sense that when I go eat at a restaurant, oftentimes the server is one of my patients, and maybe I've delivered a baby of hers, maybe I take care of his or her grandparents, and maybe at times I get a better seat in the restaurant, and maybe I get a bigger piece of pie for my dessert, but it's for me, this is one of the things I enjoy, going out in the community and running into my patients in the grocery store aisle and being asked about their test results, or or having them show me a skin lesion. I really don't mind this at all. And I think that you really do have the esteem of your colleagues that are maybe practicing in an urban area and for whatever reason can't come out to an underserved area. I really think that there's a lot of respect for underserved physicians wherever you're practicing. Again, this is why you're really needed. This shows all the counties in the United States and shows the health professional shortage areas. So these are the underserved areas in the United States. Anything in color shows where there is an underserved or health professional shortage area. And so you can see that's virtually probably more than 90% of the United States is considered underserved. The darker the shade, the more underserved the area is. As you can see, my area of the state is one of the more underserved areas in the United States and within Texas. So you can, it's not limited. You can virtually almost go anywhere through the National Health Service Corps and practice as long as it's a health professional shortage area of a certain designation, certain score. This is why I can do what I do. This is my team. This is my support network. This is my family. You can see my beautiful wife is there smiling, and then my 3 wonderful children. Blake is on the left, Zane is in the middle, and Colt is on the far right. And this team, this group really enables me to do what I can do. Without them, I could not do what I can do. I remember several years ago, I was fortunate enough to be the young physician delegate for the American Association of Family Physicians to the American Medical Association. And Susan and I went. We had a babysitter for a couple of days. My mother-in-law, and she came and took care of the boys, and we got to go off to Chicago. And we were invited to a cocktail party, and there's not a whole lot of cocktail parties out in this part of the state, so we took the opportunity to go to the cocktail party, and this was for the other young physician delegates that were representing their own specialty societies. And there was a group of about 10 of us, and I was the lone primary care doctor. I was also the lone rural doctor out there. And so it was interesting. One of the spouses of one of the specialists that was there was really interested in my rural practice and what I did. And she was really astonished that at that time I was solo and that I was on call 24 hours, 7 days a week, and how I was able to balance my professional and personal life. And she said, how in the world are you able to see your family by doing what you do, being on call all the time? And before I could answer, my wife elbowed me in the ribs and said, I've got this one. Let me get this answer. And I'll never forget this. My wife gave a more beautiful answer than I could have ever given. And she said, my husband works hard, and he at times he has to be a physician first, and he at times has to miss some things with our family. But he's there at soccer practice and at baseball practice when he can. He coaches when he's able to, and he is there for our kids. And I hope that my kids are learning about service. When my husband is not able to be here and he has to go be a physician, our children are learning about service and knowing that it's not always about you or about them, that it's about serving and helping others at times when they need you. And that was just a beautiful response to that question. Yeah, but I'm lucky to do what I do because of this. I'm also had some amazing role models when I was going through when I was growing up. I was delivered by a family physician, Dr. Ramon Garcia, and he took care of me throughout into college when I'd come home from college. And he was a rural, lone, solo family physician in private practice. And one day when I was a junior in high school, I was showing 4-H lambs, and one of my lambs died kind of unexpectedly. And at the time, I was working for a veterinarian in town, and I had seen him perform necropsies on animals before, and so I figured, well, I'm almost a veterinarian. I'm going to perform my own necropsy on this lamb to try and see if I could figure out why this lamb died. And of course, I performed a very rudimentary and bloody necropsy, and of course I had no idea why this lamb died, but the county agent found out that I'd performed this necropsy and that this lamb had died unexpectedly, and so he thought that he'd better send off the brain of the animal to the veterinary school at Texas A&M. And I'll never forget the Saturday afternoon I got the telephone call about the result from the county agent, and he said that the lamb had been tested for rabies and was tested positive for rabies. And he suggested that I contact my doctor, that I probably needed medical care pretty soon. So what I did on a Saturday afternoon is I went to the telephone book and I looked up Dr. Ramon Garcia, and under his office number I found his residence number. And I dialed that number, and on the second or third ring, I remember him picking up the phone. and I told him who I was. He knew who I was. He asked me what had happened, and I told him what had happened, and he very calmly reassured me that I did not have a significant exposure and that I did not need the immunoglobulin and I did not need the vaccine. And I'll never forget that. That made a huge impression upon me. My doctor, who at that time was about my age that I am now and had 2 children about the age of my current children, and I know what he was going through on a Saturday afternoon. He was trying to get some quiet time with his family, and here I was, one of his patients, calling him at home on a Saturday afternoon. But he was able to turn what I thought was a crisis into something that was certainly, not a crisis. He was able to assure me that I was not going to die. And he exhibited what I call the 3 A's. And this is what I would hope all of you are able to exhibit, all of us, including me, are able to exhibit, the 3 A's. He was available to me on a Saturday afternoon at a time that I needed him. He was accessible to me by publishing his telephone number in the residence pages of the phone book, and the most important thing, he was affable. He didn't get upset that one of his patients was calling him on a Saturday afternoon when he was trying to spend time with his family. And because of that, for the past 7 years that I've been practicing out here, my home telephone number has been listed in the residence of the Alpine phone book in the hope that I can hopefully either tell somebody, yeah, you really need to go to the emergency room, or, no, this can probably wait until Monday when I see you in the clinic. Make sure, I call this occupational therapy. This is Mitre Peak outside of Alpine, just north of Alpine. Make sure that you take care of yourself when as a medical student, as a resident, and as a physician, that you make sure that you take care of yourself. Before you can take care of others, you have to take care of yourself and your family. If you're a bike rider, wear your bike helmet and get exercise. Don't abuse yourself or anybody else, and don't abuse alcohol or drugs, and take care of yourself so that you can be of service to others. This is the sunset of Twin Peaks. I drove by Twin Peaks today driving out of Alpine on my way here to Presidio. Don't forget to take time to watch the sunrises and the sunsets. Yesterday morning I woke my kids up at 5:30 and we went out and watched the lunar eclipse. Take time to enjoy life and do these things. And really, I really like this, and I love this photo. To love what you do and feel that it matters, how could anything be more fun? That's really, I love what I do. You've probably run into some physicians and attendings perhaps in your training that maybe you don't think they really enjoy what they do, and I want you to know the majority of us do really love what we do, and I couldn't think of doing anything else, and I'm so blessed to be able to live where I want to do, practice how I want, and to make a very decent living out here in the places where I'm needed. This is I like this picture too. This is a British adventurer who is doing the first ever swim at Antarctica, voluntary swim at Antarctica, trying to raise awareness for global warming. And this is a great quote by Waldo Emerson. "Do not go where the path may lead. Go instead where there is no path, and leave a trail." So go out and do something different, and we'll follow you. There'll be people following you. Create your own path, create your own trail. If anybody ever tells you can't do something, just do it and prove them wrong. And I'm going to close with this slide here. This shows the web address for the National Health Service Corps. I would encourage each of you, if you haven't heard of the National Health Service Corps, go to this website and take a look at the National Health Service Corps. And it may not be right for you, but then again, it may be for you. It's been a wonderful, perfect experience, and I've been blessed by the National Health Service Corps to be able to do what I do, and they definitely enabled me to be able to do what I do out here in far west Texas. So thank y'all very much, and I appreciate all of y'all. And if you'd ever want to reach out to me and come rotate with me, we'd love to have you come out and expose you to rural border health. You can feel free to email me. You can just Google me, find my office number, find my email address. I'm available to you if I can do anything to help you.
Well, thank you so much, Dr. Billings. That was a great talk. And do you want to go ahead and say your email address on the recording?
Sure. Yeah, I'd be happy to. So my email address is bigbend, B-I-G-B-E-N-D, like Big Bend, where I live, the area, and then my initials, M-D, for medical doctor, PhD for Doctor of Philosophy at gmail.com. Again, Big Bend MD PhD at gmail.com. And my home telephone number is 432-837-9221. You can also find that in Alpine Residence Phone Book. My office number is 432-729-1800 in Marfa.
Thank you so much, Dr. Billings. While I'm starting to unmute folks so that they can ask any questions they may have, I just wanted to put in a plug for today being the National Health Service Corps' Core Community Day. So if any of you out there listening are doing something to celebrate that, or generally are doing some community service events through your FMIG or your AMSA chapter, feel free to click on the link on our page, amsa.org/ and it's for National Primary Care Week, so it's NPCW, and you can post your activities up there. All right, I think everybody should pretty much be unmuted, and I have a question coming through the chat from Stanley Daniel. He says, can you explain on how some health providers fly into the area? How long are they generally there for? And are there similar opportunities for those practicing medicine outside Texas?
Sure. So the doctors that fly in, a couple of them are private pilots, and each of these communities has their own little airport that has no commercial service. The physicians that fly in are the ones that do our emergency room physicians, and so those that fly in, they'll fly into the Alpine Airport, and they'll spend anywhere from 2 to 5 days working the emergency room out here with some breaks in between. As far as other physicians flying in and out, it's really out here anyways. It's just the emergency room physicians that do. The majority, do drive in their personal vehicle, but those that are private pilots will do that. And certainly, as far as places that come to my mind outside of Texas, in Alaska, there are many, many opportunities where physicians are flying out in bush planes out to small Native American communities that don't have any sort of health services to provide health services on a sporadic basis. And I would imagine there are probably other places as well where that happens.
Excellent. Thank you so much. Are there other calls for other questions for Dr. Billings from anyone on the call? Another one from Stanley Daniel. Regarding family medicine post-grad/residency training, what could one do to be ready for rural medicine if they were going to a program that was not geared towards a rural track and or unopposed setting?
Well, I think that's a great question, and that was the dilemma that I had as a fourth-year medical student. I thought, I want to go back home to the Texas-Mexico border in a rural area. Why would I want to do a residency program in an urban area like I did? And I think there are some amazing rural programs out there, but for me personally, I really just wanted to go to a busy urban county hospital where the volume was very, very high and where there were lots of opportunities to do and see things, and hopefully see things prior to arriving out in a rural area. I'd hopefully had already seen them at least once in an urban teaching tertiary care hospital environment. I can tell you that did not happen. Although I had an amazing residency experience, that there's obviously no way that you can see everything before coming out to a rural area, and the populations are different in rural areas. The education is different. There's less education that typically in a rural area. There's patients out in rural areas are typically more sick and have varying pathology. And you really serve as a primary care physician as really the front line, because they're going to access you for anything and everything rather than being able to go directly to a specialist. And so I think really I think if you can kind of figure out where you want to practice, what I did, I actually came out here as a medical student and then again as a resident, and I kind of had an idea of what I needed to learn and what I needed to, procedure-wise, what I needed to do going into residency. And that really, I think, helped me kind of tailor my residency experience to ultimately practicing out here where I'm at in the Big Bend. And so it's hard to believe, but you may, wherever you go, rotate as a medical student. You may actually be going back to practice there after residency.
Sounds great. Thank you. And Leah from the National Health Service Corps just chatted me a reminder about the National Health Service Corps' Core Community Day Facebook chat that's going to be tonight. I believe it's going to be at 8 p.m. Eastern Time, and I will send out the link she gave me to everyone in the chat, and I believe it's also up on our website, ansa.org/NPCW. Are there any other questions for Dr. Billings from anyone on the call?
Hi, Dr. Billings. This is Dan Orm, I'm an MSU medical student. I was just wondering if you could say a bit about what was like for your family to transition into the Big Bend area. I wasn't sure if they're from there or not, and just what that experience was like.
Sure, yeah, that's a good question too. So my wife is not from this area. In fact, she was born and raised in a very urban area in a suburb of Fort Worth, Texas. And it was my idea to come out here. And I've got a really funny story about that. When I finished my PhD, I did my PhD first, and we moved to Georgia, and I did a postdoctoral fellowship at the Centers for Disease Control. And my wife and I had just married, and I had not gone to medical school yet. And she and I were both homesick for Texas. We had a great time in Georgia, but she was definitely vulnerable and very homesick. And so at that time, I was applying to medical school, and I knew I wanted to come back to the border. And so she was at a very vulnerable time. And so I said, you know, of all the places in West Texas where you might want to live, if I accept this National Service Corps scholarship, where do you think you could live? And so she made a list, and Alpine was one of the towns, Marfa was one of the other ones, I think Fort Davis was the third. And so I said, would you mind signing this, and do you mind dating this? And so I took that piece of paper. And so then I matriculated into medical school. I accepted the National Service Corps scholarship. I went into residency back in her hometown, back in Fort Worth, and at the end of that, when I finally had to decide where I was going to practice, I pulled out that sheet of paper, and I reminded her that, 7, 8 years previous to that, she was willing to move to these towns in West Texas. And she very much, agreed to move out here. And so it was a great experiment. At the time, I didn't know if she would like it. I had two boys at the time. Blake and Zane were very young, and we had not yet had colts, so the kids, they adapt easiest. And I'll tell you that my wife has adapted really well. She's a physical therapist, and she works for the school districts out here providing specialty physical therapy services, and she has done well. Several years ago, when I was private and solo, I was really tired, and I was bordering on burning out. And I said, why don't we leave? Why don't we go to a place where I'm not going to be on call so much, and where I'll have more time at home, and I can do other things, and we can just move. Let's move. And her response was, no, we are not moving. You drug us here. I've worked hard to make friends. I am happy here. We are staying. Tough it up. And so it's really because of my wife that I'm still here. And so, I think a lot of our friends that live in urban areas say, you must have such a quiet life and be bored at times. How do you do it? And I cannot tell you, I'm as busy as I've ever been, both professionally but also personally. I coach my soccer, one of my sons every year. I'll coach either the soccer team or the baseball team, go to their practices. Two of my sons are doing piano lessons. One of my sons is doing horseback riding lessons. I'm involved in different civic organizations and church. My wife is an elder in our church. We don't have very much spare time, and so we're very busy, and that's really, we like it that way. But I think really it's a team. A lot of the reason that physicians don't go to rural areas is because of their spouse. Their spouse may have to give up their profession to move to a rural area. Luckily, my wife didn't. She was able to continue her profession and feel like she was able to give back professionally to the town as well as personally.
Well, that's fantastic. Thank you so much, Dr. Billings. Are there any other questions from people on the call? I think all my personal questions have been answered by responses to other people's questions, so it's definitely great to hear somebody who is in rural practice you know, talking about how much they like it.
Dr. Billings, this is Dan again. I have one more question. I was wondering if there's anything that your practice does to kind of extend its reach beyond what your MDs can do through, I don't know, either mid-level providers or community, anything like that?
Yeah, we do. So we have 2 mid-level providers that work with us, and we could not cover both of these clinics without the mid-levels. They're wonderful physician extenders, and they're able to, you know, hold clinics where at times as physicians we have to be in the hospital delivering babies or taking care of emergencies. And so they as well travel out to Marfa and Presidio as well. Other things that we do, you know, we try and be involved in the community. I'm a big bicyclist, and I promote bicycle helmets safety, and the Texas Medical Association has a wonderful program that provides bike helmets free to kids, and so we'll do a couple of those events every year. We have a mobile mammography unit that comes to our area because we don't have any fixed mammography at the hospital, and so there's a mobile unit that comes and parks in front of our clinics in Presidio and Marfa quarterly. So yeah, those are things. And then of course, you know, I mentioned the house calls, getting out to people who have difficulty accessing me in the clinic. We will go visit them, and a lot of times those are our patients that are bedbound and or on hospice care, and we're out trying to provide hospice care to them.
Excellent, thank you.
Thanks.
Another question from Stanley Daniel. Within your geographical region, what kind of patient compliance rate do you observe when continuity care, i.e. return visits, is desired?
You know, I have the best patients in the world, I think. They make me feel appreciated. The majority of them will do exactly what I say as long as they can afford to do, you know, what I say. We have a very low no-show rate here. Patients out here are salt of the earth, good people. A lot of them are just very, very poor, and if they make a commitment that they're going to show up for an appointment, they will do everything in their capacity to get here. So I'm really honored and blessed to take care of this population out here. I can tell you that it's a different population than my residency population. We have very little drug use out here, and it's a very safe place. You hear a lot of times that the border is an unsafe place. I can tell you when we bought our house in Alpine, we didn't get any keys to our door because the previous owner said, I don't know where my keys are. I haven't locked my house in 10 years. A lot of people will run in the grocery store and leave the keys in their car, and sometimes the car is running. And so they're really good people out here.
That's amazing. Thank you so much. Any other questions for Dr. Billings from people on the call? I'm not really seeing any so far, so I think I'm going to stop the recording here in a minute, but I just wanted to say once again, thank you so much to Dr. Billings for joining us on the call. I think this was a great topic to hear about, and I encourage everybody else to check out the National Health Service Corps.
Well, thank you for having me. I'm honored and humbled to have been asked to do this, and I wish you all the best, and I hope that all of you at least enjoy your job as much as I do, if not more, when you get done.
Thank you so much. I hope that for all of us as well.
Okay, y'all have a great day. Thank you, Jenna.
Thanks. You too.
Bye-bye.
Bye-bye.